Women have the power to transform this world. We can end crime and violence if we all agree to do one thing: share. Let's share our wisdom, share our time, share our talents, share our finances, but most of all, let's share our love. This is the Female Solution.
Hello and welcome to this month's edition of Global Talks with Zanna. And today I have a very, very wonderful guest, a very, very special lady that actually joined us last year to talk about Zenith Global Health. So we're having a slight trouble at the moment with internet, but I would like to introduce to you all the founder and the president of Zenith Global Health, Mary Akangbe. Mary, can you actually speak through the mic? I'm not awfully sure. So we have, as you can see, a little issue because internet is failing us, but not to worry because we will get Mary talking very shortly. But I just want to give you a little bit of information about Zenith Global Health. Mary founded this. Mary is in fact has worked in the health industry for many, many decades. She started out as a very experienced nurse, I think in theatre, and was specialising specifically. And moving forwards, she's become a skilled clinical researcher. She became involved in data transformation and also over the years became an invaluable coach and trainer. Having achieved from the beginning of her journey, her graduation from King's College in London. So Mary has many, many years of experience in the health industry, on the health platform, now on a global scale. Now, Zenith Global Health Awards is something extremely special, and this it's a particularly special year. We'll talk about that a little bit later. But Zenith Global Health Awards operates two very specific awards each year. So one, which is very, very important, very, very powerful, are the Zenith Africa Awards. So each year, Zenith Global operates a summit and an awards day in a different African country. Okay, so this year, back in I think it was May, Mary had the Africa Health Awards in Cape Verde, which would have been wonderful. The year before, 2024, was in Ghana. I can't quite remember the year before that, but it's been Nigeria and various other African countries. So I'll be intrigued to discover where the Africa Health Awards and Summit will be in 2026. So the other Summit and Awards will take place again this year in London. So this year, do save the date. This is the 10th anniversary, the 10th. And this will be on the 3rd and the 4th of October this year, 2025. The first day will be the summit. And then on the second day will be the awards, which I can tell you is an absolutely outstanding event. It is just so beautifully organized. the range of people. Now, I can tell you this because I was very, very fortunate and was able to attend last September in London, and it was unbelievably amazing. It's an absolutely incredible networking event, whether it's in London or whether it's in Africa. And people literally fly from all over the world. So London always caters for the Northern Hemisphere. So that's a day. What we'll do is now show you a short video, which is of the 2024 London event, and just give you a little taster to the magnificence of these awards. Let's take a little look any moment.
Gentlemen, welcome to the Zenith Global Health Awards 2024.
My name is Joycey. I am one of the nominees for the award as a rising star.
The atmosphere has been great so far. The welcoming drinks, the pictures taking, talking to people. Yeah, it's been great so far, so I'm looking forward to more.
I'm so looking forward to tonight. I hope it's awards, and thank you so much for having us.
Hi everyone, my name is Dr. Joyce Amasha and I'm so excited to have won a Zenith Award Rising Star. I'm so passionate about women's health education and really normalizing the conversations around women's health topics.
My expectation for the night is to be able to speak to like-minded individuals and really raise awareness in the healthcare sector.
This is my second time at the Zenith Global Awards, and I can honestly say it's one of my favorite things, something I always look forward to throughout the year.
Thank you very much for such a recognition. I'm truly honored and humbled.
Thank you to Zenith Global Awards for this fantastic award.
I've won this Rising Category Award in the maternal and fetal medicine health.
I'm just very, very honored and grateful to have received this award. This just reinforces not just my effort, but also the support and the inspiration that I've gotten from my family, from my colleagues, and especially from the Shuri Network.
Thank you so much, Zenith Health.
Thank you, Zenith Global Health.
Thank you,
Zenith Global Award,
for this opportunity and for this space with amazing, amazing people.
Fantastic. I really, really love that video. And I am hoping that we'll be able to hear Mary's voice in a moment. I'm not... Mary, can you hear me? Not able to talk. Mary, welcome.
Oh, I was just trying on my phone. I'm thinking, let me try something else.
The joys of the internet. It's
honestly
really wonderful when it works.
Let me try the phone, go on my data, but the Wi-Fi is working. I went to the router, I went to it. Anyway, we're here now.
We are. And I just really wanted to give our audience a little bit of an introduction as to what you, Mary Akangbe, are all about. So I had talked about your very early days experience in nursing, because healthcare has been your entire life, hasn't it?
Yeah, it has. Over 40 years.
You started out actually at King's College in London and graduated. Yes. Mm-hmm. Carry on from there for a couple of minutes, because it would just be lovely for our audience to get a grip and an understanding as to what led you to where you are today with Zenith Global Health, which is just, I don't know if you could hear me, but we talked a little bit about that. So let's just step back for a couple of minutes and talk about your early days. And because you're very skilled in your clinical research and so on, and I guess all of that wraps up to bring you to where you are today on a global scale.
Yeah, thank you very much. Thank you for having me. And everyone, I'm happy to be here. Thank you for your patience as well. My background is, yes, nursing and midwifery. Then I went into theatre nursing and I did the anesthetic course. I'm someone you can refer to as a lifelong learner. I keep going back and forth to uni. Then I trained as a specialist practitioner in keyhole surgery first. That time, keyhole surgery was just coming up. And I remember we used to call it foreveroscopy because some of the procedures that we just go in and do open was taking forever laparoscopically. And sometimes over 5 hours, we'll convert to open anyway. So it wasn't sexy, it wasn't popular, it wasn't something that everybody wanted to do. But along the line, I could see the progress, I could see the impact on patients, I could see the impact in the length of stay, time away from work, from family and children. So I thought, okay, and I have a young family of my own. So I thought, okay, let's stick with this. And gradually we advanced and people started embracing it and government embraced it. Then I trained to be a specialist in robotic surgery. So, and that came about for two reasons. Number one, when we were building the keyhole surgery aspect of the clinical care, we are now a center of excellence where Akings. We were having training, people coming over from all over the world for master classes. And I could see that everywhere in the world, people have the knowledge, the skills, just the exposure and infrastructure that are different. So in my mind, I thought, you know what, we're all doing great things in silo. Why don't we create a platform where people can come together, share, learn, support each other so that we can do the best for our patients, which is usually our focus and aim of coming together, going into the profession. And around that time, I got involved with Transforming Health in Africa as well. So, and then started consulting work plus my clinical work. That's what led to Zenith Global Health.
That's just fantastic. It's brilliant. I love it. And in fact, I connected with you somewhere around a year ago, and I've just loved it ever since. And I am, for one, more than happy to talk to everybody about Zenith Global Health.
Yeah, thank you.
Because it's and we want to get into this a little bit more. We're going to go into a very short commercial break in a couple of minutes. And then when we come back to the show after the first commercial break, I want to go into more talk about Zenith Global Africa, because that's very powerful part of Zenith Global, isn't it?
Yes, it is. It is.
Okay. I was explaining in the very beginning that Zenith Global Health Awards breaks into two dimensions, if you like. So the Northern Hemisphere, always in London. And again, here we have the date for this year, 3rd and 4th of October. So for our audience, please make a note of that.
Yeah.
And then again, we'll talk about Africa after we come back from this short commercial break. I think I'm 1 minute out at the moment, but it will kick in any moment. So when we come back, can we talk about how you have affected Africa as a continent? And because there's a lot of work to do there, isn't there?
There is. And we've got to do it together,
Yeah. So we'll come back and talk about that and how you can collaborate and other communities in healthcare can collaborate and create some increased power, really.
Yes.
Yeah. So I think that's going to be fantastic. We can do that. We will also be talking about the London Summit and Awards. Now, we focus on the awards and the glam and the glitz, and that's fabulous. But it's really important to also focus on the summit topic each year. because I always feel with you, Mary, that's very cleverly coordinated from one year to the next.
Yes.
So that's, I think, something we need to talk about in a minute.
Okay,
so
that's it.
Here we go. Let's have a quick commercial break and a sip of water, and then we'll come back and talk about that.
I like the idea of that. Yeah. Okay. All right. See you in a bit.
We are global transformers, changing the world from the way it is to the way it should be. We are one. Wherever we live on this earth, we are one human family. On behalf of our team of radio hosts, I'd like to extend a greeting to all the members of our family, whenever and wherever you may be listening around the world. To our family in China, Ni Hao. In India, Namaste. In Japan, Konnichiwa. In Korea, Annyeonghaseyo. In Russia, Здравствуйте. In Germany, Guten Tag. In Poland, Dzień dobry. In France, Bonjour. In Spain, Hola. In Italy, Ciao. In Egypt, Ahlan wa sahlan. In Ghana, Akwaba. In Nigeria, Peleo. In South Africa, Sawubona. In Senegal, Nangadef. In Kenya, Jambo. In Israel, Shalom. In Pakistan, Afghanistan, Palestine, and Saudi Arabia, Assalamu alaikum. Greetings, and may peace be upon you all. Join us live on the on-air radio network called 727-731-5192. We want to talk to you.
And welcome back, audience. And I hope you all enjoy the next part of our show, because we're going to talk, aren't we, Mary, about Zenith Global Africa.
Yes, we are.
So I would like to know a little bit more about what Zenith Global is all about regarding Africa Health. Because I think it's so incredibly important, and I think that health communities around the world can come together and make a massive difference.
Yeah, you are quite right, Zanna. And it's our 10th year this year as an organization. And in 2020, we were invited to host the same event in Nigeria, actually. And, I said at the beginning that I've been involved in transforming health across Africa for about 20 years. That's in capacity building, helping to set up specialist skills in the keyhole surgery, teaching, training, and, as a consultant for industry. So already people are aware of my work. So when we started the Zenith Global Health in the UK, we had a following from across the world, from people whom I've worked with or come in contact with or supported to establish clinical training and centers of excellence. So we were invited, and so I said to the advisory board and the people that invited us, I said, look, considering A, my work in transforming health in Africa, B, my experience at the forefront of innovation with people coming for master classes at King's, I don't think this should be limited to Nigeria. It's going to be pan-Africa. And they all agreed that, yeah, it's a brilliant idea. So then COVID struck, so we couldn't do it. We had an online session, which was massively attended. And that was the beginning of Zenith Global Health in Africa. So in 2021, when everything was getting back to normal, we went back to Nigeria. We had the first one there. When we were in Nigeria, we had offered to come to a couple of countries. And then again, the advisory board and the team look at the logistics. And one of them is having a partner who's ready to support us wherever we go, because it will be new to us, although we've been fortunate in the sense that our network goes with us to wherever we go. So no matter where we are, We have people from the UK, US, UAE, across Africa coming with us. So in 2022, we went to Zambia. In 2023, we were in Senegal, which is a French-speaking country. 2024, we were in Ghana. And early this year, we were in Cape Verde, an island on the coast of West Africa, which marks our 5th year across Africa. And like I said, any of the countries, the idea of going to different countries is that people in the neighboring countries will be able to attend as well. So that way, the people are not in isolation. They can be part of the discussion, part of the solution. They can, have partnership and everything with other people coming from other parts of the world. And usually we partner with the Ministry of Health, Either we will be invited, or when we're in that country, we will, let them know this is what we're doing, WHO representatives, everyone involved in health and institutions and private as well, we come together to make it happen.
Brilliant. So that's the one approach, the One Health approach.
Yeah. So the focus of the One Health approach is so that we take into cognizance the relationship and the impact of the environment, people, animals, and everything else around us in the ecosystem. We look at how one affects the other, because I think some of the problems has been that we've been treating health in isolation. And then when things springs upon us, it's now, what do we do? How do we do it? Where do we start? Well, now that we're beginning to appreciate the connectivity and the impact, we're able to bring everything together, which is one of our vision and mission as Zenith Global Health, that we do things collaboratively and proactively, not in isolation. That way, we will be able to achieve this global health equity journey together, and the universal health coverage as well, which at the moment is, shall I use the word no balance? We have the commitment, the achievement, not commitment, everybody's committed, achievement between 30% to 80% across the board. So some are doing really well, some are still coming behind. I mean, some countries have managed to eradicate the malaria parasite, some countries have been able to advance in they've been able to advance in antimicrobial resistance. They're even using technology to address it. Some countries are really great on procurement and manufacturing, like the vaccines, like other medications. Some are amazing in research. So the idea is we come together to strengthen each other, because we are as strong as the weakest link.
So that is strengthening the capacity, isn't it?
Yeah, strengthening the capacity, building a resilient healthcare system, and also building sustainability into it, because that's the key issue. We can do amazing work and not make it sustainable or things that people can benchmark. Then we keep going back to the drawing board, or we are frustrated because, we feel that we are not doing enough or not doing well. But if from the beginning we build sustainability into it, we take cognizance of the healthcare financing, human resource, and other things, and infrastructure, then it becomes easier to achieve, the universal health coverage, address the situation, strengthen the system.
Okay, brilliant. So you've achieved so much up to this time, huge amount, but it's not stopping, is it? You're not stopping here. You'll keep pushing forward, you keep expanding out, and you keep on collaborating with other healthcare communities, businesses. Tell us a little bit more about that. How we can generate more collaboration and bring more of these healthcare communities together.
Yeah, thanks, Zanna. Because, like I said, our mission is to foster global health equity through partnership, collaboration, shared learning, and benchmarking. And we've, like Radley said, we've witnessed a great deal of success in that area. Even some areas that we never thought would come together in partnership, we've been able to see partnership happening from Global South, Global North, Global North, Global South. People are now beginning to see that there's something somewhere for everybody. We have private institutions, we have innovators approaching us and saying, look, we've got this, what do you think? How can we scale up? Where do you see the need? What difference can we make? And what is available out there, both from both sides. And also, we are beginning to see the fact that it's not about superiority. No. It's about collaboration to see how we can work together. So we work with government, both in the UK, we work with institutions. Like I mentioned earlier, we have partners in UAE and right now in Australia.
Oh.
Yes. God. So governments across Africa, UAE, institutions in the US, and now, like I said, most recently in Australia, because I've just come back with working with the Egypt Health Authority on the Africa XCon, which is one of the largest XCon in Africa, actually. And yes, so there's a lot of public-private philanthropic partnerships that can be fostered, and we are open to collaboration, introduction, and supporting innovation in different ways.
Absolutely brilliant. Absolutely brilliant. In a moment, we have another commercial break, not very long. And when we come back, I want to be able to talk in a bit more depth about how the summits operate and the awards. So people listening, you might have somebody that's on a very small new venture that doesn't know if, they are big enough to connect with Zenith Global, or they might not think that there's enough connection with what they're doing. So it'd be quite interesting to talk about the different types of people and businesses, companies that actually can become a part of the summit and the nominations, because there will be somebody will know somebody that will go, gosh, I could nominate my friend, or I could nominate this company because the work they've done is amazing and not enough people know about them.
Yeah, definitely. Yeah, it's be great to address that, because and that's one of the unique things about us, and I hear this all the time, that we are about the only platform that caters from people who are just starting out, either clinically or in business, to people who's been there, done that, people that you mention their names and say, really, you know them, and I'm talking on a global scale. Yeah. So you come to Zenith Global Health, either the summit or the awards, and you see we are celebrating rising stars, we are celebrating nurses, doctors, allied ed, we are celebrating people who's been the first in the world to do this, first in the world to do that, to people who's made real impact in healthcare, from Black ethnic minority to Caucasians to across the globe. Actually, the diversity is palpable. That's one of the things that people say, that they look forward to coming to our events because of the diversity and because we showcase everybody. You don't have to be a big wig, although there's lots of people also say that if you want to see who is who in health, go to Global Health,
Absolutely, I experienced that myself.
Exactly. And that is from across the world, But the other thing people say as well is that they sitting in the room, they are encouraged that their humble beginning can also reach greater heights, because they hear these people sharing their experience. They share the uphill experiences. They share how they overcome. They share where they're at now, and they are open to mentoring and support. Some people bring their children, and when I say children, like adult children, right? Maybe in university or thereabout. And I've had parents saying that their children say to them that being in that room makes a difference to how they see their journey and how they are going to embrace what they've been doing. So yes, it's a platform for everyone, because I always say that our youth are our future. If we think because we are there already and forget those who are just starting either clinically or in business or in research, any other areas, then what happens when, we retire or we move to the next stage, which is inevitable anyway. Yeah.
We're going to go to a quick commercial break now. And when we come back, we're going to talk a lot more depth. Oh, you're joking me.
That's technology for you.
The Soulful Chicago Book Fair, Woodlawn's premier summer event, returns to 61st Street between Cottage Grove and King Drive, Saturday, August 9th, 10 a.m. to 8 p.m. Join us for another celebration of literary works by and about the Black experience, featuring children's books, fiction books, and non-fiction works by local and international authors. The main stage will host an entertainment lineup second to none, with Pari Lemuel, Aniba and the Soul Stars, and the mesmerizing Moo Moo Fresh. Special guest, DJ Celeste. The community stage features a variety of family-friendly performances, such as DJ sets produced by IC Music, an organization that trains and promotes blind audio engineers. All this and more, Saturday, August 9th, free and open to all. Be there. Visit soulfulchicagobookfair.com for more information.
Welcome back. Welcome back. This has
Thank
been
you.
an
This is a
absolutely
great place to be,
fantastic,
actually.
beautiful. Oh, wonderful. So here we are. This is going really quick, isn't it? Too
Yeah.
quick. Let me just read this. So we're talking about the awards, and the awards are about, I'm going to read this out. Excellence in health innovation, leadership in One Health integration, community health champion. And these are the expected outcomes: strategic recommendations, partnerships, awareness and advocacy, policy assignment. So these are all the key pointers towards what these special awards, they're very unique awards, I think. Awards go on all over the place, don't they? Globally, there's an award every week, some award ceremony every week somewhere.
Yes.
Let's go back and talk about the relevance of your awards and the Zenith Global Health Awards uniqueness again. And I want to kind of get into a little bit more about who can be nominated. So I'm going to hand over to you just to go through those bullet points that I talked of.
Okay, yeah, thanks, Zanna. With the nominations, we have different categories because, of course, we cannot cover all the details in healthcare. So the categories are like an umbrella. So when we have excellence in nursing and midwifery, for instance, we can have leadership, we can have the One Health, we can have community. Then in the last 3 years, we've had partnership in health and social care. These are the people who are not actually healthcare professionals, but they are doing great things, in health. For instance, the first group that won it actually was started by a guy who overcame cancer, and he was a businessman. So based on his experience and everything with isolation, with technology, he started this idea of when patients, are being treated for cancer, they give them phone with SIM card loaded. They provide somewhere to come and learn new skills and things like that. And they were the first in the world to do that. Nobody heard about them until they were nominated, but they are doing a great job. And then we have other people as well who works with the NHS, who works in other community to promote health and well-being, social care. But they are not healthcare professionals, but they do a lot. Even those who look after the refugees and things like that. Now, then, like I said, we have doctors, nurses, allied health, and then we have like the lifetime achievement, people who's done so much. But for us, the most important thing is you need to be able to show the impact. We don't do voting, we don't do payment to enter, but our advisory board, our judges and educators, they want to see the impact. And it's interesting the length that which they go. We are forever grateful to them, because sometimes when they come back with some information, it's like, really, So we create this platform to cater for everyone, like the health and technology. It could range from telemedicine to somebody using mobile phone to broadcast information to farmers about how to care for their health, and like some other aspects of malaria eradication, for instance, in Africa. And even here in the UK, we have different things, neurodivergent people using different technological innovations to support them, because that's something that's been going on for a long time and people either don't talk about it or so it's about the whole package, right? And also we make sure that when people come they are nominated for the awards, they have the opportunity to provide as much information as possible. And what we've experienced is that even those who do not win, being in that room, being nominated, being shortlisted was a great thing for them, because to them, they're in great company. And we always say that we wish we could acknowledge everybody, but sometimes we receive so large a number and it's difficult to just know who will win, who will not win. And we have this robust system in place where, there are criteria which every nomination is marked around. And then, depending on the outcome. Yeah.
That's brilliant. So if I had a thought of somebody that I wanted to nominate because of the work they're doing, all kinds of reasons, I can go onto the website, your website, and I can nominate, and I can see all the different categories. So it's not. I realise that it's not about the number of nominations. It's about the quality of the nomination and what stands out uniquely about that individual or that company.
Yeah, exactly. It's not the number. And we try to tell people, because sometimes people, and one of the reasons we don't do the number is because people who are busy creating impact and sustainability, they have no time to go and tell the whole country to start voting for them or to start nominating them. So we always emphasize that you don't have to have like 1,000 nominations, because you can have good number of nominations and they're all saying the same thing, or they're writing 3 lines, 4 lines. That is no use to us. But you can have one good nomination that we structure who you are, what you've done, how you've done it, the impact, the result, the why, the how. And then when our judges and the advisory board go to find out about that person, they even find out more. Somebody was nominated last year for special recognition. And during the educating, they realized that she's a doctor, that she's actually in the military. She fought in one of the wars. That was mind-blowing. And then we have another professor from Pakistan last year who is a major general in the army, and is a cardiologist as well. And the way he's transformed that specialty and health in Pakistan, now the qualification exams for surgeons, they now do it in Pakistan. And he's an examiner in the UK as well. It comes for as an examiner in the UK, but he's created a structure where people can have that exam and not have to, either travel or pay exorbitantly for the exam. That's just an example. And we have like our rising stars who are just starting out. But when you see what they've done, it's like achieving so much in such a short time that they've had the access means they will even do more as they progress. So we do that to encourage them that, look, well done, you are doing great, you're in great company. And of course, there are people in the middle as well. So there's room for everybody.
Yeah, absolutely brilliant. I must say, I said it earlier in our show that I was so fortunate to be able to attend last year the London Global Health Awards. I was blown away. It was magnificent on a whole number of reasons. The location, central London, the buzz, the hotel is just beautiful. The whole event was so special. I felt as if I was underdressed and I even wore a sparkly dress, I love it. And the fact that I don't even like to use that word networking because it doesn't sound right, although that's what everyone's doing. And a number of amazing, beautiful human beings I met on that evening was unbelievable. Across all walks of life, they flew in. We had lots of people from the UK all gathering into central London. And there were so many people that had flown in from all parts of the world. Yeah. So anyone can come from anywhere, literally, and they do.
Yeah. And it gets, better and better each year. Last year, for the first time, we had delegates from Saudi Arabia. And immediately after the event, they invited us back to Riyadh to one of their biggest exhibition. So that is one other thing. And the gathering, the other thing that people say about the gathering is that it doesn't matter who you are or who you want to speak to. You go there and it's like everybody's talking to each other. Even some people that people only read about or on maybe LinkedIn or see in the news on telly, they'll come to Zenith Global Health and you approach them and you realize that they're human after all. They're ready to talk, share, and everything. People, especially younger ones, they say to me, oh, thank you very much. I spoke to Professor or Mrs. or whatever, and they said they're happy to connect. And, it means, I can have this kind of support. And, so that gives us joy. And the good thing is it flows over from the summit, because with the summit, we try to address topical issues. Last year, it was global health equity and, with other things in between, like the One Health, like workforce development, like healthcare financing, like innovation and technology. This year is about system strengthening and, of course, diversity inclusion, especially around non-communicable diseases like diabetes, cancer. Now, everything is technology. How are we actually leveraging this for inclusion and diversity? AI, the ethical implications, and then, like I was saying, I was speaking at an event about female technology solutions, and I said, look, I'm not an expert in healthcare financing, but in the last 6 months, I've seen myself talking more, sharing more, and looking more into healthcare financing and blended finance for healthcare, especially in the global south, because we know what's going on. So we have to start thinking in other ways of creatively making healthcare affordable, accessible, and equitable.
Yeah, absolutely brilliant. We've got another commercial break. Short break, and we're going to come back and do a roundup. I want in the last quarter to talk about the awards for London in October. And we'll have another sneaky look at that video when we come back. So
Okay.
A minute and we'll be back and we'll talk about that. And also we need to show the website and how people can contact you.
Okay. Thank
you. See you in a moment.
Yeah, see you soon.
Aha! The Alexander Experience in association with We Dream in Color Foundation presents the 2025 We Dream in Color Humanitarian and Unity Celebration at the historical Du Sabo Museum of Black History, honoring phenomenal people doing extraordinary things and empowering others to dream big. Save the date, Saturday, July 19, 2025, for an evening of celebrating life in this year of elevation, where unity and diversity meet, history will be made by the clear vision of the people's chief himself, Chief Tamba Taylor, aka the Are Etesheye of Akola Ijesha Kingdom. VIP red carpet and interviews start immediately by 6:30 p.m. American time. Show presentation starts by 8 p.m. while ticket sale go publicly in mid-May. Contact We Dream in Color Foundation for ticket and reservation. Go to wedreamcolor.org or your favorite honoree. One love.
And if you're watching this, that means you're one of the 4.6 billion people from around the world who are using an electronic device to talk to people. In these times, people are using the internet to talk to everybody. Friends, neighbors, family members, co-workers. People are on their cell phones and computers all day long. Now, if you're in business, that is great news. That means you can sell your products and services all day long and never have to leave your home. All you need is a media connection, somebody to connect you to an audience. And that's why I'm talking to you today. We produce programs, and our audience members are people who shop. They buy clothes, food, beauty supplies, cleaning supplies, home repair, transportation services, child care services. Whatever you're selling, they need to buy it. We're your media connection. Just follow this link, and tomorrow you can sit back and relax at home while your business is making you money.
Well, I was dancing backstage to that amazing music and the great commercial breaks announcements. And just before we go on, somebody said that the host of this show should be at Zenith Global Health, and I agree, they should be. So let's work on that.
I would love to be there again. I can't recommend it enough. And it's just an amazing event, first of all. But Zenith Global Health, what you're doing is extraordinary. It's brilliant. And I think that the more people that can become exposed to what you're doing, your work on a global scale, can become a part of it, can become connected with it. And this is something, if you care about people around the world, if you just love people, it's something that's extremely rewarding to become even in the tiniest bit involved with. Yeah. We've literally got our last quarter and there's quite a lot to quickly get in here now. I hope that we can show, I'm just having a look, Global Health. Zenith Global Health. Where's the website? There's me stuttering away. I want people to be able to find the website. So if you literally just do a search for Zenith Global Health, Zenith Global Health Award, you'll find the website easily. And on that website, it's actually very easy. You can go in and you can nominate. So you enter the website and you find the page to nominate, and it guides you. And then you write up whoever it is you're nominating, and you can put in there as much as you like, can't you?
Yes, you can. And we always say to people, when you come to the homepage, you scroll down, sometimes it's on the glider, and you'll see the nominates now and things like that there. And we always say to people, I think on the form, it says 300 words, but don't worry, you can always write more and attach. And self-nomination is allowed, right? Because nobody knows your work and worth more than yourself. So self-nomination is that. But if somebody is nominating you, then if they think there's more that they need to do, they can attach like a Word document or send another email with the with the person's name, category, and then just do a write-up about them, and we'll put everything together. Plus the our advisory board and judges, they do their own findings as well.
Brilliant. Yeah. Brilliant. So that's fantastic. And for obviously October is London. So although it focuses on people attending from Northern Hemisphere, in fact, half of Africa arrive as well, don't they? They plane in. So it's not restricted. That's my point I'm getting to. It just because there's London and then there's Africa, the other half of the year, anyone can go to either or both.
Exactly. So like I said at the beginning, the reason we were invited and we go to different parts of Africa is because not everybody can make it to the UK. So when we are in a certain country, people in the neighboring countries can have the opportunity, A, to nominate, B, to be part of it and showcase themselves, their work, their business and things like that. And interestingly, when we go to Africa, we have an average of representation from like 12, 15 countries that comes with us, from America, from the UK, from other parts of Africa, UAE, and in all the places that we've been to, all the countries. And the global health, the one that is meant, figuratively for the UK, US, and, global north in general, we have people coming in from the global south as well. That's number one. Then it showcases people from all the parts of the world in the UK doing great things. Yeah. So you may find somebody who is in the UK and is from maybe South America, for instance. Somebody comes in from South America, it's like, oh, you do this. Oh yeah, I do this as well. But this is what I'm doing back home. This is what we're doing. Can we collaborate to strengthen what you're doing, and vice versa? So it's global in both sense. Although for the Africa event, our aim is to reach as many people as possible, especially those who may not be able to come down for various reasons. But everybody's welcome on either side, and we do have people in both sides as well.
Absolutely brilliant. So buying tickets, so nominations, we want as many people as possible to keep on nominating. Keep on spreading the word, but buy a ticket. Now you can buy a ticket for the summit.
So for the summit, what we try to do for the summit, we try to finish with the nominations and then we start promoting the summit, because sometimes we make a concession where when people buy tickets to attend the dinner, they can come to the summit for free. But if they're coming, but if they're coming to summit alone, then they pay for the summit. So that's how we charge. And we have early birds going on right now, which is, discounted. And at the end of this month, I think it goes back to the standard price.
Okay, brilliant. Brilliant. Well, I would say buy a ticket because the event is amazing. I didn't make the summit, but I think that's something that's very relevant for many people to be able to attend.
Yeah.
Because of the level of information that's been given by the people that are a part of the actual summit. You're meeting incredible people, and the volume that you can learn is immense.
Yeah, yeah, and then you see the thing with the summit as well is that the speakers, and because some of them come in from different aspects and they see that we can share and learn from each other, it makes all the difference. It's not just another one where you go and sit down and it's same old. It's different, it's impactful, and it's something that we can build on. Yeah.
Brilliant. I'd like to show the video one more time because it will make you realize why you need to buy a ticket.
Thank you. Yeah, we need as many people as possible to attend because it's a social enterprise.
Look.
Ladies and gentlemen, welcome to the Zenith Global Health Awards 2024.
My name is Joycey. I am one of the nominees for the award as a rising star.
The atmosphere has been great so far. The welcoming drinks, the pictures taking, talking to people. Yeah, it's been great so far. So I'm looking forward to more.
I'm so looking forward to tonight. I hope people get some awards, and thank you so much for having us.
Hi everyone, my name is Dr. Joyce Amasha, and I'm so excited to have won a Zenith Award Rising Star. I'm so passionate about women's health education and really normalizing the conversations around women's health topics.
My expectation for the night is to be able to speak to like-minded individuals and really raise awareness in the healthcare sector.
This is my second time at the Zenith Global Awards, and I can honestly say it's one of my favorite things, something I always look forward to throughout the year.
Thank you very much for such a recognition. I'm truly honored and humbled.
Thank you to Zenith Global Awards for this fantastic award.
I've won this rising category award in the maternal and fetal medicine health.
I'm just very honored and grateful to have received this award. This just reinforces not just my effort, but also the support and the inspiration that I've gotten from my family, from my colleagues, and especially from the Shuri Network.
Thank you so much, Zenith Health.
Thank you, Zenith Global Health.
Thank you,
Zenith Global Award,
for this opportunity and for this space with amazing people.
And that is what I was saying earlier. You see, those two people on the stage with me, the Lifetime Achievement recipients, they're in their 70s, and there are people that have done so much that people only see in the news and the paper or headlines. And there they were dancing, and even afterwards, talking to people and things like that. And this segment of it, we try to showcase mostly our rising stars, especially innovation and technology. Nurses are now in CIO posts due to upskilling and things like that. And some junior doctors are also, because like I said, technology, we need to encourage these people who are doing something in it to keep doing it to make a difference. Yes, there's another one that showcases the, not the older ones, but like special recognition and lifetime.
Yeah, absolutely brilliant. Mary, I cannot thank you enough. It has been an enormous pleasure, an honor, and the work that you're doing is absolutely outstanding. Zenith Global Health Awards is incredible. What I say to the audience is get nominating, go to the website and get your tickets and get yourself to London in October. So absolutely brilliant. Thank you very much. It's been a huge pleasure, and hopefully we'll manage to do this again because I think we could talk a whole lot more.
Yeah. Thanks a lot. Thank you so much, Zanna. Thanks everyone who's been watching, listening. Thank you, Naima, again. It's great to be here. Yes, I look forward to another episode because how time flies when you're having fun.
And I've had fun. Mwah. Lots of love.
Thank you. You too. Bye. Everyone. Thanks for having me. Really grateful.
Thank you.
Yeah.
Bye.
Bye.
We've come to the end of our show today. If you missed any broadcasts, go to our website for the audio and video archives at www.thefemalesolution.com. On behalf of our team of radio hosts, I'd like to thank all of you who participated in today's discussions. And to our global family joining us from all around the world, we say thank you. To our family in China, xie xie. India, zhanyavad. Japan, arigato. Korea, kamsamnida. Russia, spasiba. Germany, danke. Poland, dziękuję. France, merci. Spain, gracias. Italy, grazie. Egypt, shukran. Ghana, madasi. Nigeria, eshe. South Africa, ngiyabonga. Senegal, jareh. Kenya, asante. Israel, toda. Pakistan, shukriya. Afghanistan, tashakur. Saudi Arabia and Palestine, shukran. Assalamu alaikum wa rahmatullahi wa barakatuhu. Thank you, and may peace be upon you and the mercy of God and God's blessings.